Thank you for the opportunity to present our work. I have no disclosures. Our study aimed to compare two ultra-porous titanium coatings, commercially known as Gription and Porocoat, in a weight-bearing ovine model where fixation strength and bone ingrowth could be evaluated over time. Porocoat has been used clinically for over 30 years and has improved patient outcomes following hip replacement by providing early stability and promoting osseointegration. However, patients undergoing revisions of primary total hip replacement often exhibit poor bone quality, which make achieving stable fixation and osseointegration especially challenging. Gription offers higher porosity and coefficient of friction and is expected to enhance bone ingrowth in the early postoperative period. While Gription is presently available for clinical use, its potential to provide superior fixation compared to earlier materials has not been investigated directly in a load-bearing environment. We compared Gription to Porocoat by press-fitting coated cylindrical implants into the weight-bearing areas of ovine femoral condyles. Each sheep received 2 Gription implants in one knee and 2 Porocoat in the contralateral for a total of 4 implants per sheep. The study included 24 skeletally mature rams with survival times of 4, 8, or 16 weeks. The strength of the bone implant interface was evaluated in lateral condyles with biomechanical push-out tests. 2 of the structural properties of the bone implant interface are shown with Gription and Porocoat grouped for each of the 3 time points. Force at failure describes the highest load sustained by the bone implant interface. We observed that the 16-week Gription group had higher peak forces than Porocoat at any time point. We saw similar differences in stiffness, which describes the resistance to deformation, with 16-week Gription exhibiting the highest stiffness. Increased variability in the 16-week Porocoat group reduced a significant difference to a statistical trend. We observed consistently that there was more bony material adhered to Gription-coated implants compared to Porocoat, and that in all sheep, regardless of time point, Gription always had higher forces at failure compared to Porocoat. Taken together, our biomechanical data reveal that Gription provides more stable fixation compared to Porocoat. Bone ingrowth was assessed in medial condyles using backscattered electron microscopy. We quantified bone within the porous coating and found the 16-week Gription group was approximately double that of Porocoat at the same time point. However, these data did not completely agree with the biomechanical data obtained from the lateral condyles, which suggested increasing bone ingrowth over time, while the bone ingrowth data from the medial condyles remains essentially constant for Gription and decreases for Porocoat over time. To better understand this problem, we recently submitted the implants retrieved from the lateral condyles after push-out testing for BSC imaging, and the early results demonstrate a strong positive correlation between bone ingrowth and failure force. With these additional data, we hypothesized that micromotion may have undermined bone ingrowth in the medial condyles. This study is the first to directly compare Gription to Porocoat by subjecting these materials to the demanding environment of an articular joint, including direct loading and exposure to fluids, which more closely approximates the clinical environment. Our findings compared favorably with a canine unicortical model using similar implants, which showed that Gription had superior bone ingrowth and interfacial stress that improved over time. Micromotion is suspected to have undermined ingrowth in the medial condyles. We propose that inadequate press fits may have resulted in micromotion sufficient to interfere with osseointegration. This effect would have been more pronounced in medial condyles because of an unequal load distribution in the sheep knee, where 70% of load is borne by the medial condyle. Finally, we observed that achieving consistent implant placement was challenging due to the small visual window afforded during surgery, the unique curvatures of the condyles, and the presence of a tendon in sheep that limits access to the lateral condyle. These factors contributed to the observed variability. In this study, Gription demonstrated superior fixation strength and bone ingrowth compared to Porocoat by 16 weeks, suggesting it may be beneficial in hip replacement surgeries where bone stock quality and quantity are compromised.